What's up, people? Just coming back from work, wanted to hit up a hot topic about, I think I have a sinus infection. You know, we live in Austin, Texas, one of the worst places for seasonal allergies, congestion in general. So we frequently have patients coming in 2-3 days of symptoms talking about, I think I have a sinus infection, please give me a Z-Pak.
For those of you who don't know, a Z-Pak is an antibiotic, and when it comes to sinus infections, or people think they have an infection, it never starts as a bacterial infection, so antibiotics aren't really going to help. Sinus infections almost always start as a virus or allergies, and because of those things that are going on, we get congestion in our sinuses, and then bacteria can grow and eventually develop a bacterial infection. But that takes time. And so that's why we usually require people to meet a few different categories of symptoms and also time frame. Usually it needs to be at least 7 to 10 days of symptoms before we actually consider it a bacterial infection.
Yeah, even consideration of antibiotics in the first place. So unless it's a case-by-case basis where you're having a fever, actual fever, we may consider it early, but otherwise we do want to see about 7 to 10 days of symptoms. So what are things you can do at home for, kind of at-home remedies before you get to the physician in about day 7, 8, or 9 of your illness is Tylenol and Ibuprofen. Those are great anti-inflammatories. It'll help a lot with sinus pressure and pain in general. You want to use decongestants like Sudafed. You can also use nasal sprays, like steroid sprays, like Flonase or other equivalents as well. And for your possible concurrent kind of seasonal allergies, you can use any oral antihistamine. There's a reason they market several of them over the counter, different brand names like Zyrtec, Claritin, Xyzal. Some medications just work better for other people.
Yeah. So when you start having these symptoms, if you start doing these things early on, the first few days, oftentimes your body will help get those things moving and you can avoid a bacterial infection in the first place. Ideally, when we see people, we want to hopefully avoid ever having to use antibiotics. And antibiotics, they do have their own side effects. We can get yeast infections, diarrhea, stomach upset from the antibiotics, and we can also eventually with time build up resistance. These bacteria that grow will start to become resistant to certain antibiotics, and they can become more dangerous in the long run.
So we want to see, again, at least 7 days of symptoms. Try out those treatment methods. If it's not getting better, you have a fever, you're just getting worse, of course, come in, see your provider. But hope that was helpful.
Yeah.
See you in the next one.